Hello and welcome to our channel. Today, we're going to explore one of the most fascinating and potentially groundbreaking treatments for mental health disorders, psychedelic therapy. Groundbreaking discoveries in the field of neuroscience have helped us understand the potential benefits of psychedelic therapy. Research has shown that these substances can alter the activity of the default mode network in the brain, which is responsible for our sense of self and our perception of the world around us. By disrupting this network, patients may be able to access parts of their brain that are normally inaccessible during traditional therapy. Studies have also shown that psychedelic therapy can increase the connectivity between different parts of the brain, which can lead to new insights and experiences. For example, one study found that psilocybin-assisted therapy increased the connectivity between the medial prefrontal cortex and the posterior cingulate cortex, which are both involved in self-referential thinking. The potential benefits of psychedelic therapy. Groundbreaking research in the field of mental health has shown that psychedelic therapy may be effective in treating a range of mental health disorders. For example, a study conducted by the Multidisciplinary Association for Psychedelic Studies found that MDMA-assisted therapy was effective in treating PTSD in veterans. The study showed that after just 3 sessions of therapy, 56% of the participants no longer met the criteria for PTSD. Another groundbreaking study conducted by Johns Hopkins University found that psilocybin-assisted therapy was more effective than traditional antidepressants. The study showed that patients who received psilocybin-assisted therapy had significant reductions in depression symptoms that lasted up to 6 months after the treatment. Additionally, research in the field of creativity has shown that psychedelic therapy may enhance creative thinking. A study conducted by the Imperial College London found that psilocybin-assisted therapy increased participants' ability to generate new ideas and make connections between seemingly unrelated concepts. Further, psychedelic therapy has shown promise in treating addiction to substances such as alcohol, nicotine, and opioids. One study found that psilocybin-assisted therapy led to significant reductions in alcohol use in people with alcohol use disorder. Psychedelic therapy has shown promise in helping people who are facing end-of-life anxiety. One study found that psilocybin-assisted therapy led to significant reductions in anxiety and depression in people with life-threatening cancer. Patients reported a greater sense of peace and acceptance after the treatment. Autism spectrum disorders. Some research has suggested that psychedelic therapy may be beneficial for people with autism spectrum disorders. A study conducted by the University of California, Los Angeles found that LSD-assisted therapy led to improvements in social behavior and communication in people with autism. Spiritual experience. Psychedelic therapy can sometimes lead to profound spiritual experiences, which can be beneficial for some people. Research has shown that these experiences can lead to an increased sense of well-being and a greater sense of connection to others. The risks of psychedelic therapy. While psychedelic therapy has shown great promise, it's important to acknowledge the potential risks associated with these substances. For example, there is a risk of experiencing a bad trip, which can involve intense anxiety, paranoia, and hallucinations. These experiences can be difficult to manage and may be particularly concerning for patients with a history of mental health disorders. There is also a risk of physical harm, particularly when using substances like LSD and psilocybin. These substances can cause an increase in heart rate, blood pressure, and body temperature, which can be dangerous for people with pre-existing medical conditions. It's important for patients to receive psychedelic therapy in a controlled and supervised environment with a qualified therapist who has been trained in administering these substances. Why psychedelic therapy is gaining attention. Groundbreaking discovery and research in the field of mental health have helped to lift the stigma around psychedelic substances and open up new possibilities for treatment. For example, in 2018, the FDA granted breakthrough therapy designation to MDMA-assisted therapy for PTSD, which is a significant milestone in the field of mental health. This designation means that the FDA recognizes the potential benefits of this treatment and will expedite the approval process. As more research is conducted and more success stories are shared, psychedelic therapy is gaining more attention in the field of mental health. This approach offers a new and potentially effective way to treat mental health disorders that have been difficult to treat with traditional methods. In conclusion, groundbreaking discoveries in the field of neuroscience and mental health have shown the potential benefits of psychedelic therapy for treating mental health disorders. While there are risks associated with these substances, the potential benefits are significant. As more research is conducted and more therapists are trained in administering these substances, it's possible that psychedelic therapy could become a more widely accepted treatment option for people struggling with mental health issues.